Hi everybody, my name is Rachel Richard. I'm an orthopedic physical therapist who has postdoctorate education in pelvic floor physical therapy. Today we are going to be talking about pelvic floor physical therapy and what the pelvic floor is and how PT can help you. So let's talk about what the pelvic floor is. The pelvic floor is three muscles that span from our sit bones here on the sides to our tailbone to our front pubic bone. There are three layers of pelvic floor muscles and they have a lot of different jobs. The most important jobs of the pelvic floor muscles are stability. So these muscles here support our organs, our rectum and our bladder, and also the uterus in the female. So these muscles are very important for support. They're important for stability. They work with our ab muscles and our muscles on our back to stabilize everything. They're also important for sexual function and for sphincter control. These muscles hold and keep urine and poop in where they belong. When these muscles are not working properly, this leads to pelvic floor dysfunction. There are many conditions that one can be experiencing with pelvic floor dysfunction, and this happens in men and women of different ages, different walks in life. When these muscles are not strong enough, flexible enough, or coordinating properly with the other muscles, like our ab muscles and our back muscles and our diaphragm, this leads to pelvic floor dysfunction, which can cause incontinence or leaking of both urine and feces, pain with sitting, pain with pregnancy, prolapse, diastasis rectus, and pain with sexual activity, and several other conditions as well. So what happens when you have pelvic floor dysfunction and what can help? Pelvic floor or pelvic physical therapy is great for treating pelvic floor dysfunction. Pelvic floor PT is a specialized area of physical therapy that consists of the assessment and the treatment of your pelvic floor muscles and your pelvic floor muscles working with your musculoskeletal system. So not only do we treat the pelvic floor muscles in pelvic PT, but we also address lifestyle or behavioral choices that one makes that can also be contributing to your pelvic floor dysfunction as well. In pelvic PT, we work on improving your strength, your flexibility, your endurance, and your coordination of your pelvic floor muscles in relation to working with your musculoskeletal system. We also work on talking about your lifestyle choices and your behavioral choices that may be causing an increase in your dysfunction as well. We work on decreasing your pelvic pain, improving back pain and hip mobility, back mobility as well. So it's really a holistic approach, making sure that those pelvic floor muscles are working with our entire system as a whole. What will your first visit look like for pelvic PT? For the initial examination of pelvic PT, it should first include a general orthopedic musculoskeletal exam of your lumbar spine, your low back, your hips, your general core, so your ab muscles, your back muscles, your hip mobility and range of motion, and your lower extremity strength and range of motion. Specific to the pelvic floor portion of the examination, this will consist of both an external and an internal exam of the pelvic floor. So first there will just be visualization and palpation of the pelvic floors externally. We will scan the area to make sure that nothing looks abnormal or like it shouldn't be there. And then the internal examination consists of feeling of those three different layers of the muscles to feel for tightness or pain, to feel if those muscles can contract, if they can turn on, how strong are they, and are they able to be coordinated with other muscles as well. Your breathing will also be assessed, and also further questions about your sexual function, your pain, about your eating and your drinking habits and your bathroom habits will also all be explored as well, so we can really get the full picture of your pelvic floor dysfunction and do what we can to help you. Thank you so much for tuning in today to our pelvic floor video series. I hope you learned something. Please tune in next week for our first video on diastasis recti. If you are interested in learning more about pelvic floor physical therapy, or you think that pelvic PT might be right for you, please visit us on our website or our telephone number to schedule a screening or an initial exam.